It was a cold morning when Mrs. Smith rushed into the surgery, her face pale with worry. In her arms she cradled her beloved Bella, a usually lively spaniel. Bella whimpered, her tail tucked low. One look told me something was terribly wrong. Mrs. Smith pointed, her voice trembling. It's there, just outside. I gently examined Bella and saw it, a bright red mass protruding from her vulva. It was a vaginal prolapse, a condition that, while not common, always brought a sense of urgency. Poor Bella was clearly uncomfortable. I reassured Mrs. Smith that we would do everything we could, but as I prepared to examine Bella further, I couldn't help but think about the importance of understanding this condition. This experience with Bella reminded me of the importance of awareness. Many dog owners, like Mrs. Smith, are unprepared when they encounter such a situation. Knowledge, as they say, is power. And in the world of animal care, it can be the difference between a happy outcome and a tragedy. Imagine a tube inside a tube. That's a simplified way to think about a dog's vagina. Normally, everything stays put, but sometimes the inner tube, the vagina, can turn outwards, pushing through the vulvar opening. That's a vaginal prolapse. This condition is most common in unspayed females. It often happens during or after heat cycles when hormones are surging. The tissues become swollen and more prone to injury. Prolapses can vary in severity. Sometimes it's just a small protrusion. Other times, a larger portion of the vagina bulges out. It can even look like a fleshy mass. No matter the size, a prolapse is a serious matter. The exposed tissue is delicate and prone to infection. It can also become dry and painful. In severe cases, the tissue can even die, leading to complications. Why do some dogs experience vaginal prolapse while others don't? The truth is, it's often a combination of factors. Hormones play a significant role, as we've seen. Spaying your dog greatly reduces the risk of this condition, but there are other things that can contribute to prolapse. Excessive straining during urination or defecation can put pressure on the vaginal tissues. This is more common in dogs with bladder stones, urinary tract infections, or constipation. Certain breeds, particularly those with short noses like bulldogs and pugs, are also more susceptible. Their anatomy makes them prone to breathing difficulties, which can lead to straining. Even something as simple as a difficult birth can weaken the supporting tissues, making a prolapse more likely. Seeing your dog in distress is never easy, but it's important to act quickly if you suspect a prolapse. Start by contacting your vet immediately. They will want to examine your dog and determine the severity of the prolapse. Treatment depends on the individual case. For minor prolapses, your vet might be able to gently manipulate the tissue back into place. This is often done under sedation. In more severe cases, surgery might be necessary. This could involve suturing the vaginal tissues to provide support, or, in extreme cases, removing the prolapse tissue altogether. Regardless of the treatment, your vet will likely recommend spaying your dog to prevent future occurrences. They may also prescribe medications to manage pain and prevent infection. Prevention, as they say, is the best medicine. While we can't eliminate all risks, there are steps we can take to protect our furry friends from vaginal prolapse. Spaying your dog is by far the most effective preventive measure. Not only does it significantly reduce the risk of prolapse, but it also protects against other reproductive health issues. Keeping your dog at a healthy weight is also crucial. Obesity puts extra strain on all parts of the body, including the reproductive system. Be attentive to your dog's bathroom habits. If you notice any straining or discomfort, consult your vet. Early intervention can prevent minor issues from becoming major problems. Regular vet checkups are essential for catching any potential problems early on. Just like humans, dogs benefit from routine medical care. As I stitched up Bella that day, I couldn't help but reflect on the bond we share with our animals. They depend on us for their well-being, and it's our responsibility to educate ourselves about their health. Vaginal prolapse can be a frightening experience for both dog and owner, but with prompt veterinary care and a little bit of knowledge, we can help our companions live long, healthy lives. Remember, if you notice anything unusual about your dog's health, don't hesitate to contact your veterinarian. A stitch in time saves 9, as the old saying goes, and in the case of our beloved animals, it can make all the difference.